Hi, I'm Jeff Sharon from UCF Sports Night. You can now watch UCF TV 24 hours a day on Bright House Digital Channel 1.
This program was made possible by a grant from the UCF College of Health and Public Affairs, which promotes excellence in undergraduate and graduate education, research, and community service in health-related professions and public affairs.
Hello and welcome to For Your Health. I'm Charna Wiese.
And I'm Ed Heiland. In today's program, we'll take a look at an issue important to all of us, the delivery of health care, and why it takes a team to get the job done.
Plus, we'll hear why there's a growing demand for doctor-level careers in nursing. First, let's check in with Karen Guin with the latest from the UCF College of Health and Public Affairs.
We know that medicine often is not a cure, but rather a way to treat the symptoms. For patients with Parkinson's disease, those symptoms can include losing the ability to be understood. The UCF Communication Disorders Clinic is researching the right kind of medicine to help.
How are you?
I'm great.
Pardon me?
I'm great.
Wonderful.
4 days a week, Glenda wheels into a therapy session at UCF's Communicative Disorders Clinic. For the next hour, she will battle to relearn how to speak.
We have 5 more sessions, so we really have to drill you today, okay?
Drill sergeant.
Drill sergeant.
Sorry
yes.
for that.
Okay.
Parkinson's disease, which causes her muscles to spasm, also weakens the lungs and vocal cords. This video of Glenda from when she first came to the center shows how difficult it had become just to communicate.
Good, there's the quality, and now try to make it nice and loud, like do what I do. Good, that's good.
3 weeks after their first meeting, graduate clinicians Jennifer Dennis and Kia Yaguda are pushing Glenda through another tough series of exercises known as LSVT.
Good morning.
Good morning, Glenda.
How are you?
Just fine, thank you, Glenda. How are you?
I gotta think loud today.
Think loud. Absolutely.
Yeah, but we're going to stay on top of you.
I think what has made this therapy so successful versus many of the other traditionals working with Parkinson's is that when you give the patient instruction, and also not so much in Glenda's case, but in other cases there are some cognitive issues. So going through the list of things for them to do, you know, make your speech clear, breathe deeply, do this, it's all lost in the translation, and because remember I told you they've got the feedback issue, it's not as effective. However, when you give the one component, think loud, it seems to bring it all together.
That was the best yet. 14 seconds.
Progress is measured in how long she can hold a musical note.
What I do.
Another challenge is short commands.
Veronica is crazy.
Good.
It's very hot.
Good.
I can sing. Hallelujah.
And you may have noticed, volume is an important aspect of regaining your voice.
Let's just take the words amongst these landmarks.
Amongst these landmarks.
Again.
Amongst these landmarks.
Louder.
Amongst these landmarks.
Amongst these landmarks.
Amongst these landmarks.
Good. Excellent.
Amongst these landmarks.
Okay.
Amongst these landmarks.
There she goes.
Amongst these landmarks.
You're on.
Because when they start speaking loud, then automatically those other subsystems seem to kick in with the overstimulation. And so that's the point behind it.
Glenda will receive a total of 1 month in intense therapies. but research has shown its effects can last up to 2 years, and more study is underway at UCF to help expand the ability of patients like Glenda to speak up once again.
The progress that is seen with the idiopathic Parkinson patient has been very promising. They're still doing studies regarding other disorders such as dysarthria, perhaps from strokes or head injury, and that has not yet, the efficacy of those studies has not yet been published, but there seems to be some promise.
Even after the physically demanding session, Glenda is happy to be able to talk about just how far she's come.
So if you don't work in the garden, what else will you do?
Clean my room.
Clean your room. Good.
It's a wreck.
A wreck?
She is what we call calibrating herself. She has now seen that she has to speak louder in order to be heard, and now that merits the use of it, and she does that independently.
Waves of rain for purple clouds in majesty above the fruited plain. America, America, God shed His grace on thee, and crowned thy good with brotherhood from sea to shining sea.
The Think Loud program is effective for up to 2 years, depending on the progression of the disease, and then patients often need to take refresher training. Just going to make sure it's all imprinted in there so they can speak and be understood accurately.
You know, there's so much new things like this, and the Central Florida hospital community is constantly expanding its programs and research. During each 4-year health show, we're going to take a closer look at some of those efforts.
Louis Tydings has experienced a lot in his 16 years as a St. Cloud firefighter, but he can quickly identify the worst days of his life.
I was diagnosed with the ependymoma on a Friday. I had surgery on the following Wednesday, and those 5 days were probably the worst days of my life.
Surgery to remove the growth was successful, but he still needs radiation to make sure the tumor cells are completely gone. For that, he is coming to Florida Hospital's Cancer Institute to use a new, very precise radiation therapy machine called Trilogy. While Lewis's tumor is rather rare, the machine can be used on many different kinds of common cancers.
Trilogy allows us, as an example, to target a lung tumor and actually do a very detailed planning CT scan and train the machine with Trilogy to only treat when that tumor is right in the middle of the target zone. So the beam is on when it's there and the beam is off when it's not in a targeted zone. What that does is it allows us to treat the tumor, spare the normal tissue around it, so we're able to minimize side effects, we're able to give a high dose of radiation to achieve positive results, and allow the patients to maintain a normal, healthy lifestyle.
The doctors are optimistic Lewis will be able to live out his normal life expectancy. This is Jerry Klein for Your Health.
Athletic training, health information, physical therapy, just a few of the careers that lead to a critical role on a community health team.
Here to tell us more is Dr. Diane Jacobs. Now, she joined UCF in 1994 in the Department of Molecular Biology and then became the first woman at UCF to serve at the vice presidential level. She is now the chair of the Department of Health Professions. Welcome, Dr. Jacobs. Thanks so much for joining us.
Thank you.
You know, we talk about the healthcare team and jobs and opportunities and need in healthcare. And someone going into college might think, well, I'm going to either be a doctor or a nurse. But there's so much more out there, more need, more opportunity.
You're right, there is. Doctors and nurses are the healthcare professionals that most people know about, but they really make up only about 30% of the healthcare workforce. The other 70% or something, I made a little chart so that you can see what it looks like. They're allied health workers and managers and administrative support services that are part of the overall healthcare system. And without the system, you really can't deliver care. If you just have doctors and nurses, there's a limit to what they can actually deliver.
Well, let's get some of the specifics. Give us some other ideas of things that the different professionals that make up the healthcare team.
Well, there are actually more than 200 different allied health professions, but can't talk about all of them. But I can give you some examples. Athletic training is one that you mentioned, physical therapy, occupational therapy, health information management, Health Services Administration, these are the people who actually run the hospitals and become leaders in the hospitals. Cardiopulmonary sciences, they train respiratory therapists, radiographers that take the x-rays and do CAT scans and MRI. Respiratory therapists are really important. They help people who have difficulty breathing, and there are lots of examples of times when that happens. It's a very accessible set of professions to go into, and very exciting and very rewarding. And also available to people who have different kinds of skills and different needs, because you don't have to work with people all the time, with patients all the time.
Patient care is not for everybody.
Yeah, patient care is not for everybody. You really have to have certain skills. If you really would prefer to work with computers, there's health information management. Radiographers work more with technologies. They work with people as well. But if you are less interested in technology and really want to help people in a hands-on way, physical therapy, occupational therapy, speech-language pathology, speech therapy, all of these, and respiratory therapy, they really are all hands-on activities where you're providing help in a very personal kind of way.
Well, during our interview break, we'll put up some of those links so people can get the specifics as to where they might be able to get some of that additional information. I wanted to ask about the demand, though. Obviously, we all know that health care is something that we, as we age, are going to need a little bit more of as we get older, but also the country's getting bigger. There's just increasing demands on many, many different levels. What kind of opportunities are there out there for people that are looking for those
the highest demands are really in the healthcare arena. There are statistics, depending on where you look, about the top 5 or top 10 of the fastest growing professions are in healthcare. Business Week has a recent article on where the economic growth has been in this country. Since 2001, the large proportion of jobs have been created in the healthcare sector. So it's really, there are many, many opportunities for jobs and growth.
Is there a problem with the amount of teachers you have, the professors, the people to train these people?
Yes, there are all kinds of reasons why it's a challenge to train more people. One of them is that there aren't enough faculty who have the credentials to actually teach. Another reason is that so many people who've gone into the field recently, in the past, are retiring. So there are fewer of them staying in. The demand is growing because of the growth of population, particularly in Central Florida, and the growth and our aging population. We're all living longer. We still need a little help occasionally, and there's more demand for health care and for these health professionals. And in addition, these are relatively small programs that are in a financial sense expensive. They're more expensive than giving a baccalaureate in English, for example, where you can have large classes and students can do a lot of work on their own. In the clinical professions, you have to get clinical skills. So you really have to practice in the clinic. And there are limited numbers of clinical sites. We hope that as more hospitals come online, there are more opportunities for training, and that will enable us to grow our programs a bit. But it takes faculty and time to actually provide the instruction. So there are kind of challenges all the way around. Many of my colleagues around the country have built partnerships with healthcare systems to work together to try to increase the number of professionals that we're training, because it's in their interest as well. Employers actually want to hire more people. We'd like to provide them. We have to find creative ways of actually getting this done. The jobs are there.
The jobs are there. We've got some information we're going to put up on the screen while we take a short break, but we're going to come back and talk a little bit more about the health team and perhaps how you might be able to join it. Stay with us.
We're back. We're talking with Dr. Diane Jacobs. We're talking about the entire healthcare team and the importance of the healthcare team, and so much of it people don't even know about. Now, I'd like to talk about shortage a little bit. And being part of a medical family, I know that the medical shortage of medical doctors was planned, and it was planned with an oops. They really thought that the AMA federal budget for residency programs was limited. The amount of residents and doctors were limited because they didn't want to have too many of them. And now it's, oops, we figured this wrong, and there's really not enough, and it's pretty frightening. It was surprising to them. How about the shortage with the rest of the allied healthcare team? Is that a surprise?
Well, I think it's a surprise. But not because it was planned that way. Because there are so many different allied health professions and they don't speak with one voice, for a number of years people really haven't paid attention to the numbers. But now that there are more academic centers collecting data and looking at the allied health care workforce, they actually refer to it as a stealth shortage because it really kind of snuck up on people when they didn't really anticipate it. But now when you collect all the data, you find that there really are shortages, and there are major shortages in a number of areas. Again, not planned, but nobody was paying attention. Nobody took this into consideration. It took into consideration the population growth, or in places the aging of the population, and the kinds of treatments and diseases that we're going to put a demand on the healthcare workforce.
But where, if you're a parent, for example, where would you begin to track your child? What direction would you point them? And then the other part of that is perhaps the people who are parents and maybe had a career and were thinking about the health profession. Is it too late for them to get into it? So it's kind of both ends of the spectrum. Where do you start with the kids first? Okay,
if you start first, if you're interested in health at all, you have to start in high school to make sure you've got the basic sciences. Because even when you get to college, even though the science courses that you take may not be as demanding as those required for a career in biomedical sciences or to get into medical school, you still have to know some. And in science is one of those things that builds on itself. You don't start early enough in high school if you decide you don't like science at all and don't take any. By the time you get to university, it's really difficult to pick it up.
You have to wait to get to the good stuff. The first classes, sometimes people drop out and think, I'm not going to do this anymore, when the really interesting things come afterwards.
That's right. You're doing the basic building blocks. Now, there are high school programs that try to address that, that try to make it interesting with applications in the basic science courses so that high school kids understand that there really is something interesting. I can't go there, but
you can't be in every science class.
We can't be in everything, right? But there are opportunities to do that. So you start with the basic sciences just to make sure that your kids have it in high school, so that they're prepared and to take whatever they need to take in college. And then, as I said, there's a lot of information on the web. There's information available that was not available when I was a student, for example, where you had to actually go and talk to somebody to find out what the disciplines were like.
How did you find your way to it?
I just liked science in high school, and so there wasn't a question, and then I found my way in various ways. But if you're a parent and looking into this, there's a lot of information out there. There are organizations, professional organizations that can help you. It's probably too much information if you're looking to have only a very limited amount, but it's all there. We can help people. We're going to put more information on our website. If we get enough demand, we might try to find some way of having evening workshops along with the community colleges, for example, to provide this information to kids in high school. That's the kind of thing we can do. In terms of coming back, it really depends on what your background is. If the science is really, it's important if you want to be in a clinical discipline, because everything in health is science-based. Some require more, some require less. But there are a lot of positions in healthcare management that are much more easily accessible if you don't have the science, but still are interested in health, because we give everybody in say, the Health Services Administration an introduction. They take courses like medical terminology and stuff, so they actually learn the language, even if they're not practicing. they learn enough to understand what people are doing, and they can help in the management aspect of this. And there are many, many places where healthcare administrators can work. I mean, not just in hospitals, but in physicians' offices, in clinics, in nonprofits that are offering counseling, in the government. There are all kinds of opportunities for somebody who really has an interest and a passion to learn a little bit more.
So you don't have to be a doctor to tell doctors what to do.
No.
Or to suggest to them.
Or suggest to them, perhaps.
Or suggest to them. Yes. Well, if doctors are like faculty members, it's like herding cats. But, yeah.
And you don't necessarily have to work in a hospital as well.
That's right. You don't have to work in a hospital. There are plenty of opportunities for work outside hospitals. And in some of the allied health professions, you can be an independent practitioner or work for a small company delivering services at home. So they're, you know, they're all over the place. You just really have to look.
Just have to take the time and go out there and hit the web. Thank goodness
Many
for the web.
opportunities, yes, indeed.
Oh, you go ahead.
Oh, I was just going to say, Diane Jacobs, thank you so much for joining us and filling us in on this. We'd love to have you back sometime. We'll talk more about some of the careers and some of the many things that you can do to be a part of the health team.
Thank you.
Thanks, Diane.
Well, for your health is an important part of a growing medical community for the University of Central Florida. Here with an update on the College of Medicine that's coming to our Lake Nona campus in 2009 is UCF Provost Terry Hickey. Just as the medical campus is growing, so too is the need for trained medical professionals.
Today in our Career Corner, we'll take a look at what it takes to become an athletic trainer.
This is a technique I learned when I was in grad school.
Being an athletic trainer seems the perfect fit for Javier Perez. As a former athlete, Perez became interested in rehab while being treated by physical therapists for his own injuries. But he also knew he wanted to work in a college sports environment. So instead of becoming a physical therapist, he chose to become an athletic trainer.
There are a lot of similarities. We all do rehab and things like that for physically active people. But athletic trainers do a lot of emergency care. They do a lot of on-field care. So if somebody goes down on the field during a game, we would go out there and decide what it is. We'd do an evaluation. We'd provide emergency treatment if it's needed. And then we'd take the athlete in and we'd be doing the rehab just like the physical therapist would do. We also do return to play decisions. We do some psychosocial things that physical therapists don't do, like eating disorders awareness, drug testing of athletes, homesick students, and that kind of thing that a physical therapist isn't going to see.
A relatively new discipline in the field of medicine, athletic training is a clear benefit to athletes. This ball player is working on strengthening a sprained ankle through an exercise that duplicates his on-field movements.
He's a second baseman, so sometimes when the ball comes towards second base area, he's going to have to squat and try and catch and throw it back to whoever. So it is kind of sports specific to baseball. That's one of the ways we are different from PTs. We have that option as we do work with multiple sports, and we have the environment here to create an environment conducive to healing that's similar to their practice environment out on the field.
But athletic trainers are increasingly finding positions outside the realm of college sports. Rehab clinics are using them, as is the military, and now industry is tapping into the field.
Like Kennedy Space Center has several athletic trainers because they found that instead of sending them out on a workers' comp claim, athletic trainers get them back very quickly, and athletic trainers have the mindset of keeping them as active as they can be, even though they're hurt.
Which is exactly why athletic trainers have long been valued in the sports arena, because they help get athletes back in the game faster.
Working with me, he's able to get the flexibility, get the treatment to get rid of the swelling and all the components that occur after an injury happens. Swelling, the ecchymosis, the bruising, the pain, all that can be managed here with me. Whereas if he did not get treatment or rehab, he would deal with that on his own and probably be out longer than he should be.
And no team or business wants a key player out longer than they need to be. So the call for using athletic trainers is on the rise, and it's becoming an increasingly popular profession. Alicia Callanan Mandigo, For Your Health.
And that is a positive note on which to end, so we shall. I'm Ed Heiland. Thanks for joining us.
And I'm Charna Davis Wiese. See you next time on For Your Health.